that unless you're making money and you're making profit, it's not good. And those are Christians-based value, or they claim they are. What is, I cannot get this economic culture and the culture, the economic aspect of it and the culture aspect of it. You have to make money, you have to suck some money out of somebody to make sense to them.
It is this new age. Some people would label it with Barry Goldwater, but I happen to have liked many things Barry Goldwater did. So I'll just say it's the new age of conservatism in Republicans that reject what Republican Governor Arnie Carlson did here with Minnesota Care, what Republican Senator Dave Durenberger often proposed in the health arena nationally, as if you could pull the government, if you just took the government out of health care, as Rush Limbaugh says, well, look, there's nobody in this country who doesn't get health care. They just go to the emergency room. I mean, literally, that's what he's been saying.
This is our model now?
That's what he's been saying for 6 months. Now,
the guy is on, he has on drug. He's true.
A drug issue. Well, he did. But what it ignores is, I'm a capitalist. I'm for making money. Now, I also support nonprofits in the healthcare arena, and I'll give you this example. In the emergency room, if you bring your child in with an ear infection, you'll pay $400 for the diagnosis and the treatment, perhaps. If you bring your child into the doctor, and in the emergency room, you don't need any insurance. And that's where the 32 million uninsured people go. But if you have some insurance, you bring the child into the doctor's office, you pay $200. If you have a little insurance, you bring your child to the Minute Clinic, or whatever the Quick Clinic is named, and you pay $100. So from just a practical taxpayer's point of view, why would you want to deliver health care through an emergency room-based system? And that's, I think, what the Republicans have never dealt with.
I know I'm going to limb here, but I don't think it has a rationale or an intellectual framework. It's reaction to the fact. What's the role of race in all this? I mean, racism and the fact that Obama is black, and the fact there's a perception that health care insurance will cover more blacks and more poor people who happen to be black or happen to be immigrants. What is that?
Just my opinion and just my unvarnished views as normal. But if you noticed in the Obama administration, the whole proposal, and what most members of Congress did, most Democratic members of Congress, they never talked about universal health care. And until maybe the last couple weeks here, they pretty much never talked about the 31 million that didn't have insurance. Because Democrats learned with, quote, Hillary Care back in '93, and with Richard Nixon proposing universal care, and with people who fought Medicare, et cetera, that expanding coverage to everyone is not a winner with the 85% of Americans who already like the health insurance care they have, and the 90% plus that already have health care. Mm-hmm. So the debate was all about, for you people who already have insurance, let's cover your child even if your child has a pre-existing condition. Let's make it so the insurance companies can't drop you in the middle of care. To have argued solely, on the basis of we need to go to universal health care was considered both by the administration and members of Congress as a non-starter.
And that's why a major service like health to all people, which is it's signs of maturity as a country. Yes, I'm happy with my existing health care, but what I ask myself, what country I'm living in when people are dying because they don't have health care. So when we're going to reach that maturity of we accept like what happened in Europe and Canada and all that industrial. They went through all this process and they decided, yeah, it's okay, I'm happy, but I want to make sure also, there is a minimum of happiness.
What the president always phrased was, single payer Canada, that's interesting, but we need a uniquely American solution.
It has to be American.
And this solution that has been developed, if you were to look at the stock prices of the major health companies, if you were to look at the stock prices of the pharmaceuticals and of the medical suppliers, they have been going through the roof. And that gives the lie to the whole government takeover and the idea that Obama is a socialist, right? First, he bailed out all the banks. And second, he's bailing out a healthcare system in crisis.
He saved capitalism.
Yes, and he's saving these health insurance companies because their economic models when you have to send individual ratepayers in California notices that you're going to raise their rates 39% in a single year, you were beginning to touch off little revolts in the system. And the corporate folks I know, the people who are very good, who provide wonderful insurance for their employees, Ford Motor, GM, Chrysler, they were getting killed because in Japan, in Canada, those healthcare costs were being borne by all the taxpayers in the country.
Not just the company.
Not just by the auto workers or the car buyers. And so, anyway, you asked about race. Any issue to do with President Obama always has a racial aspect. But as he points out, people knew I was black even before the election. But we
had Bush.
Anybody
could have won.
And Hillary Clinton, when she was proposing the health care, there were huge amounts of sexism were involved in that.
Yeah.
But the basic objection is, and I'm trying to be fair, is
that's the problem with liberal. They try to be fair.
That probably is. But conservatives would call this another step towards the nanny state, towards governmental parentalism, towards making people less responsible for their own activities. And if that's a debate, Obama and Democrats would love to have it. The debate that no responsible Democrat or responsible Republican wants to have is this some communist plot? Is this some socialist takeover?
But this is the childish way of looking at reality, because without what the government is offering, we cannot drive, we can't traffic. When Reagan came and dismantled union, dismantled government's inspector and all that, look what happened.
But and again, what I would...
So there is a service there that private sector cannot offer in an efficient and economic, feasible way.
And Republican Minnesotans, Jim Ramstad, Al Quie, Dave Durenberger, Arnie Carlson, they all understood and understand that. However, what's also true of all those people is they're not in office anymore, and they're not having to seek election through Republican caucuses and primaries. There's a stranglehold by the strongest anti-government elements of the Republican Party that that kept the Republicans in bloc opposing health care. Today, in fact, we have Republican activists going after such wonderful